There's the Good afternoon. Mayor Joe McComb calling our public information meeting, getting it started here on October 27th. Remind you that Halloween's coming up. We want you to be safe. And my friend Boney back here is telling you to keep your safe distance during Halloween. So we'll hope everybody pays attention to that. Keep your social distancing. What I'd like to do to get us started today, and then Annette Rodriguez will come and give us some updated information from the Health District, and Dr. Bird will give us some information that we need to hear. His only comment to me was that we're going in the wrong direction, which is not good information, but it's we need to make sure that we're working together to turn that thing around. We're doing better than some places in the state, but anything up is not good. So we ask for you to continue to be diligent in the protocols to keep us safe. But some of the good news today is that we've got a third inspection report from our health inspectors, and we have some additional restaurants. And again, let me explain, if you have not been identified, that doesn't mean that you're not in compliance. It means that we have not necessarily gotten around to doing the inspection to your restaurant. So we don't have enough inspectors to hit them all as quickly as we'd like, but as we make our rounds, we are identifying those that are working diligently to be in compliance with the social distancing requirements and others of the restaurants. So as an expression of appreciation to them and a thank you, we'll be getting a certificate of compliance to them, as well as I'd like to identify them, because as we begin to get back into the idea of going out and eating, you'll know which restaurants are in compliance, and we want you to shop locally as much as you can, or maybe even start staying there and eating and enjoying the time of family togetherness or with friends at the restaurants. So let's get started here. Whataburger at 602 South Padre Island Drive, Mr. G's Barbecue, The Barbecue Man, Denny's on 5165 Interstate 37, Bluffs Landing, Taqueria Jalisco on South Padre Island Drive, Burger King on Old Brownsville Road, the Stripe Store on Old Brownsville Road, the Hi-Ho Restaurant on Morgan Avenue, El Buen Amaya, number 2 on Morgan, Sweet Swirl Frozen Yogurt, South Padre Island Drive, the Sonic Drive-In on South Padre Island Drive, La Isla Restaurant on South Padre Island Drive, Dollar General on Walden Road, Bill Miller Barbecue on Leopard, the Fresh Donuts on Waldron, Island Italian out on South Padre Island Drive, out on the island. Jalisco number 3 on South Padre Island Drive. Looks like our inspectors have gone to the island for a while, which is a good place to go, and they're finding a lot of places in compliance, so we appreciate that. Papa Murphy's on Saratoga Boulevard, Sugar on North Staples, Wendy's number 4 on South Padre Island Drive, Whataburger number 326 on South Padre Island Drive, Pockets Billiards on Leopard Street, El Jalisco Grill on Ennis Joslin, Bill Miller Barbecue number 2 on South Padre Island Drive, Starbucks on Northwest Boulevard, Jersey Mike's Subs on Ennis Joslin Road, La Escondida on Agnes, Whataburger at 1069, number 1069 on South Padre Island Drive, Gigatees, I think that's, I apologize if I mispronounced that, at 722 Tarpon in Port Aransas, the Palmilla Beach Golf Club in Port Aransas, the Agave Bar and Grill on Snapdragon in Port Aransas, Alamode Gelateria on South Padre Island Drive, Bernie's Beach House in Port Aransas. River Square, EHS on River Run Boulevard here in Corpus Christi. That looks like Navarro HS/EHS at South Padre Island Drive. Padre Pizzeria on South Padre Island Drive. Whataburger 376 on Padre Island Drive. Costa Sur Walk and Cerveza Bar at Padre Island Drive. Surfside Sandwich Shop on Padre Island Drive. Whataburger 787 on Weber. Taqueria Los Altos de la Jalisco on I-37. El Ranchero Tortilla Factory on Carmen Street here in Corpus Christi. Luby's Cafeteria on Padre Island Drive. And Subway on Leopards, Subway 57924. Burger King on Crosstown Expressway. Land and Sea Restaurant on Leopard Street. Taqueria Los Altos de Jalisco at 8151 Leopard Street. And Los Toros Tacos and Burgers on West Point Road. So we want to thank each one of those for being committed to providing you a safe place to eat and enjoy their food, and we encourage you to go by and patronize them as much as you can. They're local businesses, and they're doing what they can to keep you safe and healthy and provide you good food. So we want to recognize those good folks for doing that and say thank you. And they'll be getting a certificate of appreciation for their compliance. And then just one other word of thanks. We've taken for granted over these 5 or 6 or 7 months that we've been in this is the participation by the deaf and hard of hearing folks that have provided us an interpreter throughout, I think, every one of these public forums, with maybe the exception of one, and we realized, whoops, we've got a lot of folks out there that need their help, and they were quick to respond. So thank you and your organization. So at this time, turn it over to Annette Rodriguez to come and give us an update on the statistics and how we're doing.
Pronto se celebrará el Día de Brujas y le queremos recordar que mantenga su distancia. Hoy la directora del Departamento de Salud Pública nos va a dar su reporte, seguida por el doctor Chris Bird con su pronóstico. Hoy tenemos buenas noticias. Tenemos el tercer reporte de restaurantes que han recibido su reconocimiento por seguir las reglas establecidas. Si usted tiene un restaurante y no ha sido visitado, lo será pronto. No todos los restaurantes han sido visitados. El alcalde dio la lista de los restaurantes que han cumplido satisfactoriamente con las reglas. Le queremos agradecer a los restaurantes que han colaborado con nosotros para mantener seguros a sus comensales. Ahora dará su reporte la directora del Departamento de Salud Pública, Annette Rodríguez.
Good evening. Annette Rodriguez, Health Director. I am going to start with the COVID-19 daily cases today. City Manager Zanoni sends his regrets that he could not be here today. So we're looking at the daily COVID-19 cases over the last 2 weeks. So starting in October the 14th, 2020, all the way to the far end, you see 6 cases, and then it jumps up to 38 cases, 33, 39. It comes down to 11. And then 12, 19, 25, 27, 38, 41, drops down to 21, 18, 11. And so while the numbers are improving over the last couple of days, our daily average, our 7-day average, our 7-day average stays high because of those high numbers that we were talking about from October 21st. So we'll talk more about that. Next slide, please. So here is our donut graph, and it basically depicts that you have a total of 21,219 cases in Nueces County. So 20,404 at the bottom have recovered, so they met the criteria, the 10-day recovery period, or if they were hospitalized, the 20-day recovery period. Active cases, it stays at 373, and no deaths today, but a total number of deaths of 442. Next slide, please. So the hospitalizations for patients, if you look at from October the 19th to today, you see on October the 19th, we had 60 patients hospitalized with COVID-19, thinking that maybe we were going to drop below 60. But we had some admissions, so 62, 64, 62 patients, 68 patients, 69 patients, 63 patients, and then the last 2 days, 60 patients. And so the numbers, again, continue to go up and down, and so we have to watch them very carefully because our goal is to drive those numbers down. Next slide, please. These are the ICU COVID patients, so patients that were needing more than just regular care in the hospital. They were needing intensive care. And so the numbers since the 20th are 21, 21, 18, 18, 23, 26, 21, and 19. And so our numbers, have gone below 20, but we've been there before, and then they go back up. So we're still going up and down on our numbers as well. So we hope that all of these individuals recover and can go home to their loved ones and family members. Next slide, please. These are the total COVID-19 deaths. It's a cumulative number, so since the beginning of our first death to today, we've had a total of 442 individuals that we have lost to COVID-19. Next slide. These are the daily COVID-19 cases. So you see they resemble the regular bell curve, the blue bar graphs, and then you have the 7-day average. And today's 7-day average for daily cases is 26 per day, if you look at that average over the last 7 days because of those high numbers that we've had that I pointed out at the beginning. Next slide. And this is really the same slide as the previous, except you see the yellow on top of the blue bar graphs, and those are the state data dumps that they have sent us over the last month or so, and we've included them in the appropriate days that those cases actually occurred. So you see the same bell curve, just see them with higher peaks for a total of 21,209 total COVID cases in Nueces County. I'm going to change hats for a minute, and I'm going to talk a little bit about some of the things that we're doing in public health. But first, I'd like to extend my condolences to all the families that have lost someone this month due to COVID-19. Please accept my deepest sympathy to you and your loved ones. So last Wednesday, the Health District conducted a COVID-19 drive-through where 53 individuals were tested, and 10 of these tests came back positive for COVID-19, giving us a positivity rate of 18.87%. The next drive-through is scheduled for tomorrow at the Health District. If you're experiencing COVID-19 symptoms, you may go on our website at www.cctexas.com/coronavirus under recent updates, and you can self-register for the drive-through. Or you can always call our staff at the Health District at 361-826-7200, and they will help you get registered. So the Health District encourages everyone to get vaccinated against the flu, and CDC also recommends everyone 6 months of age or older get their flu vaccine to protect themselves, their families, and our community from becoming severely ill from the flu. So don't wait, get vaccinated. We're in flu season now. COVID-19 has been with us for almost 8 months. It has disrupted our daily lives and routines. It has altered some lives beyond repair. We yearn to return to normal lives, when we could go outside without a mask, and social distancing was an unknown phrase. As we approach November and the ensuing holiday seasons, the presence of COVID-19 continues to be a challenge. We are seeing more positive school cases. We're seeing positives from people that have recently traveled to areas considered hotspots, like El Paso and Florida. We also continue to see family units passing the virus to one another. While our new daily cases are not in the triple digits, they appear to be slowly increasing. We see 3 days of high numbers and 1 or 2 days of lower numbers. Low numbers are phenomenal, but does not mean we can slacken our public health strategies that we have been practicing all this time. Our low numbers are simply a good indication that we should continue practicing those public health strategies until we have a vaccine in place. We all must have the same goal: 0 positive cases, subsequently no hospitalizations, and subsequently no deaths due to COVID-19. This must be our goal as a community. If one group does not make this their goal, as a community, we will not be successful. We can only beat the virus if we all do our part. Celebrations tend to attract people from all walks of life. Every activity that includes interacting with others has some degree of risk. The upcoming Halloween weekend is a perfect example. Remember to make your Halloween plans to include social distancing, wearing your mask, and washing or sanitizing your hands frequently. The decisions we make and how we choose to celebrate this weekend will determine how our numbers will trend. Let's celebrate safely while keeping our numbers low. Evaluate your risks before you go out. Wear the appropriate mask under your costume. Do not substitute a costume mask for the mask you wear daily. When trick-or-treating, follow the social distancing rule by staying 6 feet or more apart from others. If there are traffic guidelines or guidance in the yards, follow them. Example, there may be an enter and an exit sign. Follow those enter and exit signs. Help your children to follow those signs. Carry hand sanitizer to use as needed. Find alternative ways to celebrate with your family and friends, such as hosting virtual costume contests. Avoid attending large events where social distancing is impossible. Remember Mr. Bones and do your part to stay apart. Above all, if you are sick or in quarantine, do not participate or attend any activities. Stay away from others so that you do not spread the virus to others, and give yourself time to fully recover. Have a safe and healthy Halloween, and as always, stay informed. I will now turn it over to Judge Canales. Thank you.
En las últimas 24 horas se han reportado 11 casos por el coronavirus. El Estado reporta 2 casos. 3 casos están confirmados positivos y 10 casos son probablemente positivos. 20,404 pacientes se han recuperado por completo, 60 continúan en el hospital, 19 están en la unidad de cuidados intensivos, 373 son casos aún activos. A la fecha se reportan 442 fallecimientos. Primero me gustaría extender mi más sentido pésame a todas las familias que han perdido a alguien este mes debido al COVID-19. El miércoles pasado el Distrito de Salud realizó la toma de especímenes. De 53 tomas, 10 resultaron positivos, arrojando una tasa de positividad del 18.87%. El día de mañana se va a llevar a cabo otra toma de muestras. Si usted cuenta con síntomas y quiere hacer una cita, puede llamar al 886-7200 o acudir al portal de internet al www.cctexas.com/coronavirus. Continuamos exhortando a todos los residentes mayores de 6 meses de edad de vacunarse contra la gripe. Ya son casi 8 meses desde que el coronavirus interrumpió nuestras vidas y rutinas diarias. Ha alterado algunas vidas sin posibilidad de reparación. Anhelamos volver a nuestra vida normal, cuando podíamos salir a la calle sin cubrebocas y el distanciamiento social era una frase desconocida. A medida que nos acercamos a noviembre y la siguiente temporada navideña, la presencia del COVID-19 sigue siendo un desafío. Estamos viendo casos positivos en las escuelas, así como en miembros de una sola familia. Muchos de ellos han viajado a zonas con altas tasas de casos, como El Paso y la Florida. Aunque aún no contamos reportes en los 3 dígitos, los casos van en aumento, por lo que pedimos no bajar la guardia. Nuestras cifras bajas son una buena indicación de que debemos seguir practicando estas estrategias de salud pública hasta que tengamos una vacuna. Las celebraciones e interacciones con más personas tienen un alto riesgo, especialmente ahora que celebraremos el Día de Brujas. Recuerde incluir el distanciamiento social, usar el cubrebocas y lavarse o desinfectarse las manos con frecuencia. Ahora la juez Bárbara Canales va a dar su reporte.
Thank you so much, Barbara Canales, Nueces County Judge. Today, Tuesday, October 27th, 2020, I want to rejoice in one important statistic that Director Rodriguez went over, and that is we have 20,404 recovered individuals from Nueces County. I think that is very important to note. But today I'd like to cover 5 points, and they're all important, I believe, for our health and safety. First item is that I have orders ready, not issued yet, but ready for Tropical Storm Zeta. This storm is expected to become a hurricane by Wednesday afternoon, and we need to be prepared here. So we are organizing everything that we need. As with Tropical Storm Beta, you'll recall Beta was not too long ago. We are not in its path in this storm either. But as you know, the effects of tropical storms are felt far beyond the directed path. And due to current conditions and likelihood of coastal flooding, we're going to have to be monitoring the situation very closely. And so I'm in contact with coastal parks, and if we need to restrict vehicles for a very short time because the water has come all the way to the dunes, we ask for your patience. The minute that water recedes, you'll be able to safely drive on the beach again. So keep in touch with us and be listening for updates. As always with these storms, high rip is always an issue. It will most likely be a red flag week. So I urge you to use caution should you choose to go to the beach, and please make sure that you have all of your senses about you, because large debris sometimes is very hard to detect in the surf zone. So as I said, the Nueces County Emergency Operations Center is continuing to monitor weather conditions. We're going to make any operational decision that's necessary to protect life and preserve property. These orders, as I said, if they have to be implemented, they will be lifted as soon as it's advisable to do so. I want to make sure that you guys know that please to obey all the posted signs, follow all the instructions that are given to you regarding law enforcement and cleanup personnel, so we can restore the beach as quickly and as safely as possible. So that was our first safety item. The second is COVID reinfections. I was asked several times this week by news media regarding COVID reinfections, and it's my understanding from the Department of Health that we have 2 cases of COVID-19 where the patients have been previously infected and with the coronavirus, and they recovered. And unfortunately, they have been infected again and have fallen ill. So, asking me to really comment about this is a little bit out of our wheelhouse. These are medical matters, but I want you to know that there is at least 2 strains of the virus, and viruses can change slightly. So we don't know if the second cases are milder or more severe than the first. Again, I just am here to emphasize that our understanding of the virus is still so new. And we need to understand that as we gain experience, we want to share it with you. And of course, what does this all really mean? Even though it's just 2 in a sea of 367,000 residents, this is what it means to me. Do not let your guard down. That is the message I have to bring to you today. Do not assume that because your family member has had COVID that you're immune. Continue to follow all these precautions that we know. Those are those 3 W's Annette's always talking about, because they work. Isn't it great that you actually have a recipe that works? Washing your hands, wearing a mask or facial covering, and maintaining your social distance, and avoid crowds when you can. So the third point for public health and safety is that we have a COVID clinic available for any of the 20,000 that have recovered, that have concerns, or for anybody that's currently infected. This is a tremendous feat, and we're so proud of having established this COVID-free clinic in our community, because it is a tremendous resource. And of course, it's available to anybody with or without insurance who have tested positive for COVID. The clinic can get you the care you need, manage your symptoms from home, and will be there for you to assist you getting any additional help if you need to see a doctor or go to the hospital. I just want to urge everyone, use this resource. It's free of charge, regardless of your ability to pay. And I'd like to share with you the number again today, and that's local number 361-826-8019. Our fourth point today is that the county is ready for any potential second wave. And whether that means a small surge or a large one or potential for vaccinations, what lies ahead for us is, I think, good news. And that is Director Annette Rodriguez and all of the healthcare stakeholders in our community have been gathering often to discuss the methodology, the importance of prioritization, and an overall plan of action for when we get vaccinations or when we get another surge. And I know you're going to hear from Dr. Bird today, so I want you to listen to what the latest science and data tells us. What I want you to really take away from my comments is that Nueces County is ready. We are ready for anything that's presented to us in emergency management. Now, of course, I always end my evening every night praying that nothing happens to us. But if it does, I want you to know that we have had the collective efforts of all of us in emergency management and in health, city, county public health, to be ready and prepared. So when vaccinations are approved and available, we'll be ready. We have built our healthcare infrastructure to handle capacity, the COVID clinic, the alternate care site, and a patient management system to track those who we've tested and who are sick and those who have recovered are all unbelievable endeavors that we have in place now. We're not talking about them. We have these resources in place today. So we're able to look at data and identify our most vulnerable populations and reach out to them to help them with information with regards to prevention, testing, early treatment, medical resources that they might need to fight this disease and, of course, we hope recover. So, again, we have put into action those important tools. So when vaccines are available, we're going to have the means to identify those who will benefit the most from it. And we'll be able to reach out to them so they can be the first to be vaccinated. Now, these are incredible structural improvements in our county healthcare system. And I'm really proud of the fact that we work to ensure that these emergency actions that we're taking today will help become our source of resilience for the future. Bottom line, I like to repeat it, Nueces County is ready for the future, no matter what it brings. I hope it brings the stillness of the night and that we have very low numbers all the way through the end of the year. Now, finally, our fifth and final point on public health and safety is I'd like to give you an update on voter health and safety outreach program that we've dubbed Vote Safe Nueces. This comes from emergency management, and if you've been to the polls, you've probably encountered signs reminding you to wear a mask, maintain social distance, and wash your hands. And you might have seen Director Rodriguez on television and heard our public service announcements on local TV and radio stations and on billboards around our county. Vote Safe Nueces also has a website, which is called votesafenueces.com. Information is available in English and in Spanish. It covers in-person voting and absentee voting and how to do it in a safe and healthy way. And we've also have links to other trusted health information from the Texas Secretary of State, which has issued safe voting operating protocols from the CDC. We all want voting to be safe and secure, and the right to vote is a fundamental part of our democracy, and nothing, not even this pandemic, should deter any eligible voter from exercising their right to vote. So I urge you, as Dr. Ram, our local health authority has, Director Rodriguez, Dr. Dante, and the whole city county public health, vote safe Nueces and log on to votesafenueces.com. See what you can do to make voting as safe as possible for you, for your family, for your community. Once again, our great thanks to City County Public Health for this incredible endeavor that comes from emergency management. Vote Safe Nueces. Thank you so much.
Son varios los temas que voy a tratar. Primero, la tormenta tropical Cera, la cual se espera convierta en huracán el miércoles por la tarde. Afortunadamente, no nos encontramos en el paso de la tormenta, pero existen las condiciones para crear inundación en las playas locales, por lo que el acceso al tráfico vehicular estará restringido. Si va a la playa, tome sus precauciones. El Centro de Operaciones de Emergencias va a monitorear la situación en cuanto a la tormenta y se tomarán decisiones en caso de ser necesario. Estas órdenes van a rescindir una vez que la tormenta haya pasado. El segundo tema es la reincidencia de infección por el COVID. Actualmente contamos con 2 casos de pacientes que estuvieron infectados con el virus, se recuperaron y volvieron a reinfectar. No sabemos qué fue lo que sucedió en cada caso. Lo que sí sabemos es de que le pedimos a usted que no baje la guardia. La clínica de atención a pacientes por COVID continúa disponible, es gratuita y el número a llamar es el 826-8019. El condado de Nueces está preparado en caso de ver una segunda ola de casos por el COVID. Rezamos porque esto no suceda, pero estamos preparados. Hemos construido la infraestructura para manejar a capacidad, así como un lugar alternativo con la clínica ambulatoria. Contamos con información de nuestra población vulnerable, pero los mantendremos a todos informados, con pruebas disponibles, tratamiento temprano y los recursos médicos que necesiten para que superen la infección y se recuperen. Y cuando las vacunas estén disponibles, contaremos con los medios para identificar a quienes más se van a beneficiar y sean vacunados primero. Por último, le quiero dar la información más reciente en cuanto a las elecciones para votar de manera segura. Si ha estado en las casillas de votación, ha visto nuestros anuncios y tal vez ha visto o escuchado nuestros comerciales. También tenemos un portal de internet. La dirección es votesafenueces.com. La información está disponible en inglés y en español. El derecho a votar es fundamental y hacemos lo posible para que lo haga de manera segura. Ahora el doctor Chris Bird nos va a dar su pronóstico en cuanto al COVID-19 en nuestra región.
All right, good evening, everybody. My name is Dr. Chris Bird. I'm here on behalf of the COVID Task Force. We're here to talk to you about this week's numbers and trends. Our objectives are to address your concerns about COVID-19 and the interventions that are taking place to address the COVID-19 pandemic, as well as to help support evidence-based decision-making. What this means just means that we look at what's happened before and the outcomes, and we pay attention to that when making new decisions moving forward. There's been several interventions that have taken place. Stay home if you can. If you're 65 or over, you're encouraged to stay at home. If you come in contact, or you're encouraged to try to keep your distance from people that have been out in public in the last 14 days. Social distancing and face coverings are still recommended. They're actually more recommended now than before because we're going to higher capacities, more face-to-face schooling, and these sorts of measures now make more of a difference. Self-isolate if you're symptomatic or exposed. For example, if you're sick, then you kind of don't want to send your kids to school if you've got COVID. You want to hold them back. If somebody in your household has COVID, other people in the household really shouldn't be going to their place of business because you're contagious before you're symptomatic, so you might not even know that you have it. I've also heard from the public health director that here locally there's been people that are testing positive more than once. And so even if you had COVID before, it's not a silver bullet. And it doesn't mean that you can't get it now. That's one of the reasons why I myself continue to wear a face mask. There's been school restrictions that are still in place. We're not at full 100% face-to-face schooling, but we're kind of dialing that back, and we'll see what the foot traffic looks like at the schools this week. And we've gone through a variety of Open Texas phases. Most recently, we're at Open Texas Phase 3, and we'll move forward from there. So this week, our transmission rate is somewhere between 1.3 and 2.0. This is higher than in the previous weeks, and both models agree this week that we're going up. And so the 2.0 is a kind of a scary high number. We're not sure that that's the correct number yet. Hopefully it's more in the 1.3 direction. But this comes from 2 different models. And then what you see in the background here is the output of one of the models where it's estimating the lower number presently with a large amount of variation around that number. So what a transmission rate means is if you get COVID-19, how likely are you to transmit it to additional people? A 1.3 means you're likely to transmit it to between 1 and 2 additional people. 2.0 means you transmit it to 2 additional people. At that point, that's a major outbreak that could be triggered by a transmission rate that is that high. Now, we can only be so certain at this point because as you transition from going down to going back up, it's very difficult to home in on that transmission rate right now, so we need more data before we can get more certain about what it is. Going to our number of confirmed COVID cases in the coastal Bend area, we're at 24,151, and these are people that tested positive with the PCR test, not the antibody, not the antigen, just the PCR test. And there's been 23,000 recoveries of those who tested positive and are considered a COVID confirmed case, and we're at 406 active cases. If you look really closely, you'll see a little uptick there, and you'll see a little uptick here down the active cases. That means that we're going up. You'll be able to see it a lot more clearly right here, where if you go back several weeks ago, we're coming down, and there's these random blips up and down, and now look at this past week. 10 of the 12 counties are up this week, so that looks like a pretty good trend that is not just a random blip on the radar. In one of the counties, all the counties are up. Nueces County over the past 2 weeks has been steadily increasing, and so that's the first time we've been able to say that since back in July. This is the first time we're really steadily increasing. Last week, I got asked a lot of questions. Are we increasing? I said, well, it looks like we are, but you can't tell yet. This week, we can definitely tell. We're definitely increasing, and not just in Nueces, across the coastal Bend. And look at Jim Wells. I mean, Jim Wells is not a big county, and yet the number of cases, this is not per capita. The number of cases on average per day in Jim Wells is just about as high as it is in Nueces County. It depends on the day which one's higher. In terms of percent positives, last week we saw something in the public health data. This is one of the reasons why we break it out into these different categories. It was high last week, 25%. This week it's still high, but what else is high is all the testing data is high now. It's up to 15%, and the mobile testing is up to 10%. So we're seeing across the board increases in the percent positives. The reason why we present these different data sources is for these two starred ones, the public health department and the mobile testing. We know how many people tested negative as well as how many people tested positive. It is an exact percentage. For the blue, all Nueces testing, we don't get all the negatives from CVS or Walgreens or whoever else is doing all the other tests that are out there. We only get all the positives. And so because of that, this number is not an accurate reflection of the total positive rate. It's an overestimate of the total positivity rate. Nonetheless, everything's up across the board through time, and you can compare back to the left side of the graph and see that we're quite a bit higher than we were, say, back in May when things were pretty calm. You can also see here how we compare to the rest of the state of Texas. We're here in South Texas in this gold line, but I'll get your attention on these other lines here. These are places where the number of cases is really going up, and really going up means more or as much as we did during the summer. So El Paso, Lubbock, Amarillo, they're in a full-on outbreak like we were over the summer. You can see they had an outbreak over the summer too, just not as big as ours was. Now their fall outbreak is as big as our summer outbreak. Dallas-Fort Worth area is trending upwards. Wichita Falls is included in that. That's one of the places that's really driving these cases upward, and we'll be watching that in the future. And here we are in the gold. You can see that. And what I want to bring your attention to is right here. We're just turning upwards slightly right now, and we'll see how that progresses as we move forward. Moving on to hospitalizations, one of the things that triggers rolling back of Open Texas from phase 3 to say like phase 1.5 or so is if the hospitalization rate goes up to 15%. And so today we're at 5.5%, so we're nowhere near triggering a change in the interventions right now. What I'll encourage everybody to do is, given that we're starting to trend upwards, it's more important than ever to wear your mask, to social distance, wash your hands, do what you can do to stop the spread now while the case numbers are low before it really gets out of control, because the last thing we want to have to do is roll back Open Texas phase 3. We want to keep restaurants open, big box stores open, things like that. The one thing I'll tell you, remember El Paso. This is one of the places in Texas going through a huge outbreak right now. Their public health department analyzed where people were getting sick, and they found that 50% of people were getting sick at restaurants and big box stores. those two categories combined. And then the rest of the 50% was made up of everything else. So be careful when you're out there. Make sure that you're doing your due diligence when you're going out to a restaurant, when you're going to a big box store. Don't hang around longer than you have to. Going from the percentage of people in the hospitals that are COVID positive to the people in the ICU that are COVID positive, we're at 26 people in the Coastal Bend right now that are COVID positive out of 142 people in the ICU overall. Now, if you look at just how many people are in the ICU, we're kind of back down to what I would consider normal levels. If you compare back to the left side of the graph where we were back in May, early June, before the outbreak. However, the difference is there's 26 people that are in the ICU with COVID that weren't back then. So what that means is this is 26 people that don't have COVID, that aren't getting that extra care that normally they would be getting. And so this is what one of the things that we're trying to do to get these numbers down lower. You'll see the trend, or you can look at this and you can see the trend. We've been pretty level for about a month now with the number of cases in the ICU. There's not really a big movement downwards or upwards. There's a slight trend overall upwards in the hospitalizations in the Coastal Bend area right now. Moving on to fatalities, we're at 721 fatalities in the Coastal Bend area. And this number feels like it's getting pretty big to me. I mean, it was big when it was a couple dozen, but now it's 721. We're headed for 1,000. And I hope we don't get there, but we're on our way, especially with the cases increasing again. One thing I want to bring everybody's attention to is in Jim Wells, the fatalities have been increasing. Now, a couple weeks ago, I thought maybe this was a data dump or an anomaly. Last week, I started to inquire about it. This week, the pattern's still there. This looks to be a legitimate increase in the fatalities in that county, and it coincides with an increase in the cases that are occurring there. So much so that on average more people are dying per day from COVID in Jim Wells than in Nueces County. This is not a positive development, and we hope that this will change in the near future. Moving on to our projection of the number of fatalities and the trend, this is zoomed in on the Coastal Bend area, and what you can see is these points are the actual number of cases. We're level now. So we're not slowing down. We're getting the same number of fatalities day after day. It doesn't look like it's going to go down to 0 anytime soon. And the model is projecting it's more likely to go up than go down. I want to remind everybody that these fatalities come from the state. They come from counting death certificates where people have been, or where it's been determined that the people that are on this list, they died from COVID, not as a secondary cause, as a primary cause. And it takes time to count these cases. So that's why we only have data points back to 2 weeks ago. It usually takes 14 days for all the death certificates to get counted and reported by the state. And so as we move forward, we expect these numbers will probably stay about the same, but they could start increasing also. How do we compare to the rest of the state? We're right about in the middle here in the Coastal Bend in terms of ranking and the number of fatalities per day per capita in the Coastal Bend area. Again, the fatalities are leveling out. And the reason why we're so high, even though we have a low number of cases compared to the rest of the state, is that there's a delay between when you get infected and when you get symptomatic and when you go to the hospital if you have to go to the hospital. And for those that die, there's a delay for that happening. And so these fatalities that we're seeing, they're still left over from the summer peak. And people get sick for a long time and they fight COVID for a long time. And that's why we're still so high. So this is still an offset from the summer numbers that we had. Moving into the cell phone data, we're only going to show one graph this week. The cell phone data is interesting because it can show us what might happen in the future, given that there's usually a 1 to 2 week delay between when you get infected and when you test positive. Cell phone data is closer to real time, so we can get a little peek into the future. I only show graphs I think are really different from what you've seen before. So we're going to continue with this school graph where for the first time K through 12 school foot traffic has eclipsed the professional and technical schools and looks like it's continuing to increase. University foot traffic has decreased in the past couple weeks, and junior colleges are still slightly increasing. Junior colleges, this is going to be Del Mar primarily, universities, TAMU, CC, TAMU, Kingsville, UTMSI out in Port Aransas. Those are the types of establishments that we're talking about here. So we'll see how this progresses moving forward, but we're still well below the 100% of normal that we had back before the pandemic started, so we'll continue to track that. In summary, the transmission rate is up. It's definitely above 1. We're estimating right now somewhere between 1.3 and 2.0. We'll be able to tell better next week which one is a closer estimate. Are we closer to the 2 or are we closer to the 1.3? The new cases, they're definitely increasing locally. And it's not just like, oh, it's higher today than yesterday. It's that we've gone through a trough, we hit bottom, and we're now moving up on a longer time scale. Over a 2-week sort of time scale, we're going up. Hospitalizations are increasing slightly, but not substantially. We'll see if this becomes a pattern or if it's just kind of a one-time thing where we're going up a little bit, and maybe next week it'll be back down. The fatalities are leveling off, but not slowing down. So that's something to take into account now, that it doesn't look like we're going to be getting down to an average of 0 over, say, like a week anytime in the near future, unfortunately. And lastly, it's important to consider that as we open up Texas, which we're in a kind of, the most open Texas has been since the pandemic started. And the weather cools and changes, and we get into this flu weather, then face coverings and social distancing become extremely important. It's not time, because we have higher occupancy or higher capacities, that you take off your mask or you social distance less. It's because we have these higher occupancies, to be able to keep these, we need to be more vigilant about wearing masks and making sure we wash our hands and self-isolate when we're exposed to people that are symptomatic or when we're symptomatic ourselves. I can't overemphasize, almost every single person I know that's told me that they've gotten sick this year has said they don't have COVID. And when I ask, oh, you tested negative? They say, oh, no, I didn't get tested, I just know. So, I mean, that's not the right way to think about it. As soon as you have any sort of symptoms of being sick, a tickle in your throat, a fever, a cough, not all these things together, it could be any one of them, get tested, find out if you have COVID, because by then you're already contagious. Not everybody has really bad symptoms. Some people have no symptoms. There's a huge range. And so it's important that you don't spread COVID to those who do have really bad symptoms. Let's see. And we'll end that there, go to the translation, and then take some questions.
Las intervenciones no farmacéuticas continúan vigentes, por lo que le recordamos que continúe practicando el distanciamiento social y todas las otras intervenciones. Si está enfermo, no envíe a sus hijos a la escuela, ya que el riesgo por contagio es mayor, y pero aún que ahora los casos han habido reincidentes. Esta semana el radio de transmisión aumentó, ahora se encuentra entre 1.3 y 2, lo que significa que una persona infectada puede infectar a 1 o 2 personas saludables. Los casos confirmados en nuestra área, que incluye 12 condados, son a la fecha 24,151. 10 de los 12 condados están reportando un aumento en casos positivos. El condado de Jim Wells es el condado con mayor reporte de casos después del condado de Nueces. Comparado al resto del condado, las áreas con mayor reporte de casos son El Paso, Lubbock, Amarillo y Dallas. Las hospitalizaciones por COVID se encuentran en el 5.5% en nuestra área. Si rebasamos el 15%, entonces, conforme a las órdenes del gobernador, muchos establecimientos tendrían que cerrar nuevamente, por lo que le pedimos que continúe tomando sus precauciones y así evitar más cierres. Actualmente, 26 pacientes están hospitalizados en la unidad de cuidados intensivos con el COVID. El número de fallecimientos se encuentra en 722. Una vez más, el condado de Jim Wells reporta un aumento considerable. Las muertes en el área de la costa continúan consistentes. Las escuelas también continúan reportando un mayor número de estudiantes que acuden a las escuelas en persona. Con el cambio climático y la temporada de la gripe, es importante seguir utilizando su cubrebocas y tener buena higiene.
Okay. My name's Tiffany Anderson. I'm with the task force. I have questions from Facebook Live.
Should we have Director Rodriguez come down too?
Yeah, these might be for you. So first question, do most probable cases have a positive test, antigen, or antibody? or are they meeting the other criteria instead?
Oh, that's a great question, and that's if most probables, are they mostly antibodies, are they mostly antigen? And so for the last 2-3 weeks, we've seen the majority of them are antibody positives, but then lately, like today, the majority of them are antigen. And so you're kind of seeing a mixture still, which just means people are getting tested wherever they feel they can afford it, they want to go there just to find out if they're positive or not. But whether it's an antigen or antibody, if it meets the criteria, we count it as a confirmed case. So,
Thank you. Another question, how many hospital patients are coming from nursing homes or long-term care facilities?
okay, so how many patients, COVID-19 hospitalized patients are coming from nursing homes or long-term care facilities? We do know that we have, some that are coming from these places to the hospital. I don't have an exact number.
Thank you.
Thank you. So, seeing no other questions, thank you so much for being with us this evening, and we will meet again next week. Next week, I'm not sure on the date because of election, so Thursday? So next Thursday, we will meet next Thursday. Dr. Byrd and myself, the mayor, as well as Judge Canales and the city manager, Peter Zanoni, should all be here to give